Hi everyone, welcome to our prenatal and postnatal presentation. We're so happy that you're here. We hope that you gain some benefit from this presentation and feel free to ask any questions along the way. We're going to cover the following topics. Basically, prenatal discussion. We're going to talk about how to deal with fear of birth and what to do to prepare for the birth of your baby, and some self-care exercises that you can do to prepare. And then that will follow with our postpartum discussion and how to care for your baby after birth. And then we'll follow it with a Q&A section, and then what's next. Okay, so just to give you an introduction of myself, my name is Grace So, and I'm a registered massage therapist, reflexologist, SRI facilitator, and Angelic Reiki master. I have been in the health and wellness business for over 30 years, and I'm certified in different modalities, about 30 of them. Most of my clients are either prenatal or postnatal clients. I want to introduce you to Anna Krylova, who has worked as a midwife in a maternity hospital and prenatal clinic for 12 years in Russia. She has also taught at a medical college for 5 years. She herself has three children. She has also led a mother's school where women prepared physically and psychologically for childbirth and learned to care for their newborn. Today, she continues to help women prepare for childbirth based on her own experience, both as a mother and experience gained in her career as a midwife and teacher facilitator. So, here is Anna.
Hi everyone. Thank you joining us. I'm happy to be here and address some areas to would be helpful in your prenatal and postnatal preparation. I help women in various situations. I work with the fears of the pregnant woman and woman in the labor, help physically prepare for childbirth, help establish breastfeeding, teaching self-care and newborn care after childbirth. For example, working out the fear of the big belly helped one of my patients to keep the pregnancy. She was diagnosed with the habitual miscarriage in the early stages of pregnancy. Another example, physical preparation for childbirth. It helps a woman stay res- uh, resilient and teaches how to properly distribute strength and energy at different stages of childbirth, like athletes. Athletes, for example, marathon runners, they always know in which part of marathon they should work hardly, or they should just give them a little bit rest. So the childbirth is the same as a marathon. So you have to know where you should keep your energy for the next stage, or you can work now more hardly. So this is one of the really important things. And now I want to more discuss about the four most common pregnancy fears associated with the childbirth. Fear of the pain, the close to the childbirth, the most of us thinking about how painful it will be and how long it will be. How long will be the first stage? How long will be the second stage? And how it painful will. And we're all different. We all have different levels of pain tolerance. And if we really know what is going on and what happening in each stage, uh, we don't know. We really don't know how long it will take, because for everyone it will different. For example, I have my own three kids, and they're all different. The first stage, second stage, third stage, and for example, for first one, the first stage was 10 hours, and for third one, the first stage was 45 minutes. This is like really different. So, and again, the second stage, the first one, I really don't remember because it's really short. It was so short. And for the third one, it was almost 2.5 hours. So it's really, really different for different women, for different kids, and you never know. But when you know what is going on now, it's more helpful. And also, when you know um, what to do, for example, breathing exercise, or what kind of posture I can get now to release my pain, or where I can do massage myself to release the pain. So that's what I teaching the woman to prepare for the childbirth. So the second fear of uh, unjustified medical intervention. So this is again about our knowledge. What we know about the childbirth process. What's supposed to uh, what you might feeling on second, for example, stage, when it's everyone thinks it's the same stage, and just when you have to push the baby. No, it's a little bit different. So the baby start calming down during the birth channel, and it's doing a lot of biomechanisms during whole this channel, and if you don't know what is going now, and might what process or what stage, what the baby doing now, why I feel so uncomfortable inside me, why it's happening. And so of course you never know when the, for example, midwife came and say, okay, I have to I have to do something. So, and if you don't know what is going on, you say, okay, do, because you don't know what. And you have to, sometimes you have to ask, but you shy to ask why you're supposed to do this procedure, or why you're not supposed to do this procedure, if I don't want this procedure, how it's will reflect to uh, my baby, for myself, and different things. So it's again, it's about our knowledge. If you know what is going on, what's happening now, so you can ask right question for and get right answer. If even if you don't want to do anything, any injection or any procedure, you can say, okay, so I know, at least for myself, I know what is going on. I don't want this. Just don't do that. And you have this right to say, no, I don't want this. Or, okay, I want this. Go ahead, do it. So this is another thing. The next fear of rupture and childbirth. As a rule, tissue rupture during the childbirth occurs as a result of inappropriate behavior during the pushing period. And also, ruptures can be the result of inflammatory process or trash. Uh, Birth preparation and breathing techniques can help to anyone to avoid that that things, the ruptures, right? So, and we can all these discuss in a private consultation or group of childbirth preparation classes. So all these were discussed with the woman. So the first fear of the unknown. Again, I already explained that when you don't know what supposed to be and how what kind of feelings you might have, or I don't know, emotional status as well. So you never know. Sometimes a woman can get easily the panic attack during the birth during the birth process, because again, this is panic attack might happening just because the woman don't know what is going on right now, why it's so painful, why it's so uncomfortable, or what the doctor or midwife, what they supposed to do with me. So there's again where all this discussed, and it's so important. Again, why it's so important working with the fears? Because the fear, any fear, um, any fear is um, how it's explained better. So okay, so we have the most famous and very important hormone for the childbirth is the oxytocin. The any fear starts with the hormone adrenaline, and adrenaline is a hormone which is decreased level of oxytocin. That means that more we have fears in our head, then lower level of oxytocin will be during the childbirth, and that means uh, most common situation next, the doctor or midwife, not midwives, usually doctors, they prefer to get you oxytocin through the infusion system, so and through injection, right? So and it's not good, not good for mom, it's not good for the baby. And it's I can say I've seen so many times this, and I heard so many times from the other woman. There's it's more painful than even the original natural childbirth process.
Great, thank you, Anna. So if you guys have any other fears that you would like addressed, we'll address that in the Q&A section. And it's great to really address these because these are common fears, right? Okay,
Yeah,
so
it's more common.
yes. So let's look at preparing for childbirth. There are four things that you can do to prepare for childbirth, and that is movement. Like try to walk at least 20 minutes a day because this will help you move the fluid through your system and mitigate any kind of fluid retention. The other thing you can do is do some strengthening exercises, um, as well as 3 times a week. So if you haven't done any exercises before, then you make sure that you start off very slowly. Don't kind of suddenly join a vigorous workout activity. Breathing exercises are very important, okay? As well as because learning how to breathe will help you with the movement and the birthing process, and getting regular massages too, because sometimes if you sleep on one side more than the other side, you might develop trigger points. So getting regular massages will help mitigate that, and so that you can get a better sleep. All right, so here are some let me see if I could get to the next slide here. Yep, here you go. So the exercises that you can do, the benefits of the exercises is basically to help you relieve the back pain, improve your circulation. It will strengthen your muscles in preparation for labor, increase flexibility and your energy, and you will actually feel less fatigue. The precautions mentioned with exercising is, ensure when you're walking, you can walk and talk while you exercise. This will ensure you do not overexert yourself, okay? Also get proper rest after your exercise, so up to 3 times a week and not more than 5 times a week. This will help you maintain correct posture is also really important. For example, tilt your pelvis and straighten your back. Things to avoid when exercising include any rigorous bouncing or arching your back or bringing your feet over your hips. And do not do sit-ups past 45 degrees. The most important thing as well is drink lots of water before, during, and after exercising to prevent any types of dehydration. Okay, so here are some prenatal exercises that you can do. Um, for example, pelvic floor exercises. You can do wall slides. Like I mentioned, if you have never done these before, please start off very gently. You can do knee extension exercise by sitting on a chair. Tailor sitting exercises, that's another one. Walking lunge is also another one. Step ups on a step or on a stair. Wall press is kind of like a push up, except you do it against a wall. And then there's neck rotation. Sometimes our neck gets really stiff, especially if we're lying on one side and mostly on one side. And then there's the outer thigh lift. And then, so those are some suggested prenatal exercises. Okay, so um, the one thing that before we get into the postpartum discussion is as your pregnancy progresses, remember your coordination will be affected. So, because of your increasing weight that you're carrying, which can shift your center of gravity, so avoid activities that require precise balance and coordination. Decrease your exercise level as your pregnancy progresses because your increased body weight will require more energy to exercise, which will make you feel even more tired. And switch to simple stretching and strengthening exercises as you progress in your pregnancy. Um, the frequency, you can do it daily, you can do it 3 times a week, or even once a week. The intensity you can work up to about 5 to 10 repetitions a day. You can hold each position or stretch for 20 to 30 seconds. I would say anywhere between 8 to 15 seconds, it's great. Do not stretch to extreme discomfort because your joints are looser during pregnancy, okay? For aerobic activity, do not exercise beyond the point where you will increase your body temperature. Sustain aerobic activity for 15 to 20 minutes as long as you are able to talk comfortably and you're not short of breath. Aerobic exercise can cause your body temperature to rise as your metabolism increases. So be well aware of that. And low or non-impact aerobic swimming or cycling are also recommended. Okay, so like I say, walking, if you don't want to do any exercising, walking is
Just
the best thing for you. Okay, great. So I'll turn this over to Anna, who will talk about postpartum and, talk about that stage.
yeah. So postpartum has two different period, not period stages. I can say the earlier stage, which is the first 2 4 hours right away after childbirth, and late stage, the first 6 8 weeks after childbirth. And during these 6 8 weeks, physiological changes continue and associated with the recovery of the woman body after pregnancy. Postpartum changes. So we have two stages of postpartum. The earlier stage, this is 2 4 hours after childbirth, and late stage, the first 6 8 weeks after childbirth. During the 6 8 weeks, physiological changes continue associated with the recovery of the woman's body after pregnancy. So, what is going on really then? The placenta begins after the childbirth, placenta begins to shrink strongly, and after a few minutes, it occurs and round shape. Wall of the uterus become dense, and this gapping wells of the placenta side contract. So this is kind of, you can see, you even can feel that plus the uterus going on the one side, and it becomes so strong, and you might feel again contractions. So even and midwife or doctor, they're seeing how its placenta is going out, and they even can might asking you to push a little bit one more time to do birth of placenta. And right away after the placenta will uh, birth, the uterus become again like with this like balloon shape, and it will stay like on a level of 16 weeks of the pregnancy. So, and again, and these first 3-4 hours very important uh, to control of blood, of bleeding, I can say. So that's why it's the first 2-4 hours so important. And again, we come back to oxytocin, and that period oxytocin is very, very important for for two things. The first things to contract uterus pretty well after the birth. Uh, and the second point to uh, good to have good level of oxytocin. This is for the kind of future breastfeeding, and it why it might happening, why it's so important for baby and for the mom right away after birth having baby on the chest. And it's better if the baby will start sucking right away. They give a breast like right away after the birth. So this is two important things, and how to oxytocin uh, keep going in a good level. So what next? And at first about the lactation a little bit, right? So the first few days, usually the milk starts after 3-4 days, sometimes earlier, sometimes a little bit late, specifically after C-section. The usually milk starts later, but in the first 3 days, we are having uh, a colostrum. This is very important for the baby, and it contains more more than 10 times nutrients than milk. And it's, you don't, for the baby you don't need so much. That's why it just 1-2 minutes for the breastfeeding on the first day. It will be okay. 5 minutes, no more than 7 minutes. You don't have to keep baby around the birth like an hours, as we can see for example in movies. And you have to know that otherwise you will receive some problem with your breast. And baby don't need it. He might habitually just soaking your breast, and that's it. But no eating, no food really. So that means you don't have to keep baby for 10 20 minutes, 15 minutes with the breast. first day and second day, and when the milk will come, uh, the first time you can feel that you have fever, the breast so rocky, and it's pretty much could be painful. What are you supposed to do? You have to just give a breast for the baby to feed uh, to feed uh, and its baby will do naturally everything for you. If baby doesn't want to eat for now, you have to just let it go out for for a few millimeters to give to your breast a little bit like relax. So um what else about the breastfeeding lactation?
Okay, thanks Anna for that amazing presentation. Um, we're come to the Q&A section of our presentation, and so I have a couple questions that got submitted.
Yeah.
One is someone wanted to know whether to take anesthesia or epidural. What would you suggest?
Okay, this is good, really good question. So, I am myself. I never taken any anesthesia or epidural in my all three birth. So, because even for me as a medical person, so I just think this is was my one fear that I don't want any any intervention in my body. So I want to do everything naturally. So and this is again about the how you prepare psycho-emotional for the childbirth, how you ready, how you understand the whole process. And it's some women say, okay, so I don't want to really feel any pain, so I will do it. Okay, go ahead, this is your choice, nobody can stop you. So but there is some might happen problem after the epidural. Yeah, so I've heard, I never did myself, but I've heard so many times different stories about that. Some women receive the headaches after the epidural. Some women said, so I suffer with the pain for a long time. So some women said that yes, I got the epidural, but it was awful just because half of my body feel everything and half of my body doesn't feel anything. This is feeling so awful. So this is what I heard from different situation, different women. Of course, some of them say, "Oh, that was perfect." So I got epidural, so I didn't feel anything. So uh, my birth was so smoothly, but I'm pretty sure they received some side effect of it. So because you never, this is it's not natural to have a epidural. We have first of all we're receiving the hormones which help us to release the pain during the childbirth process. If we know about the process and we know how to help ourselves with the breathing exercise, with the different positions which helps to release the pain. And if we really know that the pain for the specifically for for the birth, this is really good sign that everything is going on right. um, and it's very important to feel it, that okay, so I have pain, I have really good contraction, that means the cervix is opening. right? So when it's fully open and the baby start going down uh, through the birth channel, so okay, so now I feel kind of pushing things inside me, and I have to uh, like doing more this pushing. Okay, that means baby start going down. So this is again sign, and I know that is what is going on, and it's going on right. So when you don't feel anything and say, okay, so I have midwife, I have the doctor, okay, they will do everything for me. So this is again, like you said, that means woman doesn't prepare for childbirth, and she just let it go as it goes. So
Mm-hmm.
this is my opinion. This is just my through my through experience
Yeah.
during the work.
Right. Thanks,
So
Anna.
sorry.
That's okay. So the next question is more for me. What to do when you're sorry, what how long should I wait to get a massage after giving birth to a baby? I would suggest waiting at least 4 weeks. Um, Waiting at least 4 weeks. That gives you a chance to heal and to heal on from the inside out. And also, as you feed your baby, I know sometimes some women hold the baby in one on one side of the arm or the other,
Yeah.
and you'll start to develop some kind of tension in that area. So it's good to release that tension. And if you decide that you are, uh, that you're getting a lot more low back pain after birth, that's helpful to relieve the tension as well. And also, if you've had a C-section, that also helps. Helps you to recover a lot faster. So I would say at least about 4 weeks before you come in for another massage. Okay. And so the next question is for you, Anna. What to do when the baby won't stop crying? I'm sure you have lots of
Oh yeah.
experience with this, and what would you suggest?
About the crying, what I can say that is crying. This is a way how to baby try to give us know that he have something to for example, the baby wants to eat, or the baby wants to sleep, or the baby having some problem, for example, with digestive system, right? So and you will recognize different crying. Even by crying, you can say what the baby wants for now, because this is verbal connection to the mom. The crying is not just because baby have problem or just want to cry. So that means the simple way, if you really don't know what the baby wants for now, so you can try step by step to see. For example, you can start to check up diaper. So maybe it's full and baby needs to change. If the diaper okay, maybe baby wants just your attention, and you have to talk to her or to him, right? Just a little bit play with the baby. um if, if it's everything all right, so you already playing and the baby continue crying, so you can check, okay, um, maybe baby having colic, so they just massage to the tummy for a while. So maybe if he wants to eat, and you can say, okay, the last breastfeeding was like 3 hours ago. hmm Maybe baby wants to eat. Try to feed the baby. So this is different problem, different crying, and mom gradually with the first baby, mom gradually will know what type of crying, what saying baby wants to eat, baby wants to sleep, baby wants to attention, baby having full diaper and it needs to change. So this is general suggestion. So more we can discuss and then
Mm-hmm. Mm-hmm.
uh, because it could be different situation, different condition. So, but the general thing the mom's supposed to know that the crying, this is verbal connection to the mom.
Right. No, that makes sense. Thanks, Anna. So the last question that I have here is, because of COVID, I'm not sleeping well. I can't have my relatives over. What should I do? Um, I would say I'll try and answer that, and if you want to jump in and add your thoughts, that would be good, Anna.
Okay.
I would suggest that as you when your baby is sleeping, try and see if you could also rest and relax, even if it means putting on some really good music or meditating, and that way you're resting when the baby's also resting. The other is, if you are with a partner, maybe have some time out for yourself, because it's very stressful, because your body's going through a lot of changes. It's very stressful to try and maintain all the things that are going on in our environment, the lockdown and all that, as well as deal with things on your own, like learning how to take care of your baby. So really self-care is really important, because the more you take care of yourself, the more you will be able to manage taking care of your baby and all the things that come with it. Okay, so that's my suggestion, and then come in for a massage.
Yeah, for sure. So I can say yes, Grace, you're right. So I can add a few tips for uh, our moms. So the first thing, so the mom should understand that the good bonding is very good for the baby, for the health baby, and for mom as well. So the first months, at least a few months, at least months, but better months, 3 months, the mom have to be with the baby kind of 24 hours. So, and that's if you can see the schedule of the baby, as I can say, that most of the time baby are sleeping. It's just wake up to eat first month, wake up to eat, a little bit play and sleep. Wake up to eat, a little bit play and sleep. And between these two breastfeedings, mom, uh, of course, have to look after herself. And later on, when she gets better and might you can understand baby better and uh, uh, how to care of the baby, how to care of this herself. So she will more relaxed. But of course, sometimes baby having a problem with the colics, and it's uh, unsleeping nights. Oh, and when you uh, during the day, if you don't have anyone to help you when a baby going sleep, just let it go. All housing works. Go to sleep with the baby, rest and relax, because stressful situation affects on the breastfeeding, affect on the milk production.
Mm-hmm.
So, and it's so important having breastfeeding for at least first 6 months until you start giving another food. So the breastfeeding is so important for the immune system for the baby, and we have to understand that. And without resting and self-care, it's not possible to having good breastfeeding. And of course the partner has to be the right hand for the mom, for the wife, for the woman who is having baby. So sometimes just address to them some housing work. Ask for the help. Don't be kind of shy. Don't get everything on yourself. And if it's someone can help you really with the housing work, this is really really important help. Not taking the baby from the mom and mom start doing housing work. This is not right. So mom's supposed to be with the baby. This is important as for mom than as for baby.
Mm-hmm. Good
For
point. Yeah.
for the yeah, for the psycho emotional and physical health for the both.
Right. Yeah, no, that's a good point. Thanks, Anna. So we've reached the end of our Q&A section. So let's look at what's next. So both Anna and I suggest if you need further support or have other questions, you can reach us by email or by phone. So here is our contact information. Anna is willing to provide. She does also gives consultation. So she will give anyone who has attended this gathering 15-minute free consultation. Am I correct in that, Anna? Yeah. And
Yes,
also,
sure, you're correct.
yeah,
Yeah.
yeah. And also, if you guys have any questions in regards to, self care as well, you can certainly email me or call me. I will be happy to speak to you about that and support you in your process, your prenatal and postnatal process. So we wish you guys all very much best of luck. And also, we want to thank you so much for joining us on this presentation. We hope that it has been helpful to you. And do feel free to reach out and don't be afraid to ask for help because this is a very, very important process in your life,
It's true. It's
Yeah.
true.
So remember that birthing is very sacred. It's a very beautiful process. So no matter what your religious beliefs, your upbringing, your fears, you can do this. And you're not
It's true.
alone. All right? So Mother Nature, of which you are a part of, is going to help you. So the birthing rhythms will take over, and when you understand and get comfortable with that process, you those cycle and with comfortable with the cycles of the rhythms of birth, what is pre-birth or post-birth, you will be masterful at it because you are made for it.
Yeah, for sure.
Great,
This
thanks
is
yeah, go ahead.
so I just want to add a little bit small thing that every woman's supposed to understand that is the pregnancy and childbirth as well. This is natural process, and anything should get into this process. So we have to be during the childbirth with ourselves and get into the process. So I into the process I mean with the mental, with the emotions, feels, and physically as well. So and it's really the moment of the birth. This is really really amazing and unforgettable moment for any woman.
Great, thank you, Anna. Thank you everyone for joining us. Take care.
Take care. Bye.
Bye bye.